Hey guys, welcome to SourceFED. I'm Joe Beretta. The World Health Organization released the numbers associated with the worst Ebola outbreak in recorded history, and to date, the numbers from West Africa are thus. The virus has killed 1,229 and sickened another 1,011. And these are just the cases that people actually know about. The numbers could be much, much worse. Although the spread of the virus can be controlled, it is proving difficult due to burial practices where family members mishandle infected bodies and a general lack of knowledge concerning the virus in local populations. On Saturday, fears of the further spread of the Ebola virus were heightened when looters ransacked a Liberian health center housing infected patients. The mob fled with blood-soaked bedding and mattresses while frightened patients possibly carrying the disease scattered into the streets. It wasn't until early Monday morning that all 37 patients were found and returned to proper care facilities. That's good. What's not good is the possibility that they pass the virus on to other unsuspecting groups of people. Now, the rest of the world is diligently fighting against the further spread with flight restrictions to infected countries, as well as the swift quarantine and testing of individuals showing Ebola-like symptoms. A woman, quote, from Africa was quarantined in Germany after showing signs of the virus, and multiple people have been tested here in America as well, including, most recently, a 30-year-old who just traveled from Sierra Leone. The count on testing in the U.S. currently stands at 6 tested, 6 negative. That's a great Ebola batting average. But that doesn't include the 2 American health workers who contracted the virus while doing good deed stuff in Liberia. However, they are now recovering in the U.S. after receiving an experimental drug called MZAP, a drug developed inside a tobacco plant with an antibody that has a vendetta against the virus and directly attacks its butt. So far, 5 people have been pumped with MZAP. The Americans and 2 African doctors responded favorably, but 1 Spanish priest died shortly after. He was Europe's first Ebola-related fatality. Now, there is a moral debate on why this stuff and other experimental drugs have yet to be shipped out to the poor and suffering African countries. The short answer here is because they've yet to complete safety trials, but numerous people contend that that shouldn't matter and they want it shipped out immediately. The compromise, it seems, is that scientists are trying to expedite the testing phase before the serum and those like it are deployed in Africa. And in people suck news, products have started popping up online claiming to be cures, but the FDA stresses that there are no such medicines in circulation as of yet, especially on the internet. So don't get duped is what they're saying. In the meantime, it's essential that information and proper health practices are relayed to the people of the affected areas to help quell the spread. Guys, let me know your thoughts on all of this down in the comments. After you're done with that, please like the video and subscribe to the channel and click the annotation to watch more SourceFED. I'm Joe Beretta. Thanks for watching.